Hi, it's Ashley. I wanted to give a couple tips for basically for knee surgery. Some of the things that I really actually did use, and this is my fifth knee surgery. So, ice machine, cryotherapy, that is an absolute must have. If your insurance does not cover it, you actually can buy a version on Walmart. It's not as good as the Breg. Um, the Breg ones, if I'm saying that correctly, are literally the best ones. It will numb your knee, and honestly, it's better than medications too. So, and it helps significantly reduce swelling. That was, if you had to get one thing for knee surgery, that would be the thing that I would get. If you did want to buy anything extra, um, I just got saran wrap to wrap around my knee to shower. I honestly was not comfortable with my fears and standing up to take a shower, so I just purchased these little wipes. They're waterless, based like bath wipes to just kind of keep yourself cleaned up because for some reason I sweat a lot too with the medication they give you. But those would be the two things that stock up on snacks, things that you can reach while you're in your bed. They want you, or at least for me, they wanted me weight bearing as soon as possible. So, and it was too painful. So anytime if I had to go to the fridge or I had to go and get something, I would always put a robe on. So that way I had pockets and I could bring as much stuff back in each trip. So for each surgery, I learned something new to help me plan for the next one. And with each surgery, I've learned that every recovery is different. For instance, August, my right knee, I whipped through everything. I was driving at 3 weeks. I completed my PT. Everything went great except for I have an anchor that's lifting, but that's because of a previous MPFL surgery. And then this recent one that I did on December 8th, it is taking forever. A little bit past 90 degrees, but it takes a lot to get me there, and I'm miserable. It is definitely not the same. I had a different mindset with my last one. This one, it is hard to get up, go to class, to just drive my kids to school. Sleeping is not great yet. It is just hard to be comfortable. I'm constantly stiff, and I feel like all I'm doing is trying to get my leg to bend, literally, and trying to hope that I can stand longer than 10 minutes. But at 5 weeks post-op, I don't know if that's good, but my PT says I'm doing great, so I will trust him. But if you can relate, or if you want to follow along and support, I would appreciate it. Just hit the like button and subscribe, and I look forward to providing more content and hopefully giving some tips to anyone else having knee surgery or loved ones having knee surgery that might help. And please, if you have any tips or advice, something you've gone through or something that has helped you in your journey, leave a comment, because I am always looking for new ways to try and make recoveries easier. This is my fifth of my sixth surgery. I do need one more to fix the anchor. And then eventually I will need knee replacements. So that would be a total of 8 knee surgeries in my lifetime. So fingers crossed, no more injuries, and I'm going to focus on my physical health. Thank you so much. Bye.